Thank you very much for giving me the opportunity to talk about this important issue. It's about the use of antipsychotics in residential care and nursing homes. And I have no conflict of interest concerning this presentation, and also some of the slides have been provided by Dr. Olazaran from the Maria World Foundation concerning the Cron criteria, and I will talk about that later. This is my agenda for today, and some first point. This is one quotation from Jonathan Swift, the Irish satirist writer. Is every man desires to live long, but no man will be old. And in the Travels of Gulliver Travels, he described one of the first modern descriptions of dementia, but not also the clinical characteristics, but also of the deep impact in culture and society of these kind of processes. And first of all, I think that there is quite a high rate of institutionalization, but also I think that this tendency is going to grow in the next years, in the next decades. Here we have some data from the European region, but also some data from Spain. In Spain, we have, in just one decade, an increase of about 100,000 beds, residential care in Spain. And also, more developed countries tend to have a higher rate of institutionalization. And the point is that social evolution, probably, my guess is that it will accelerate this trend towards institutionalization, because there is going to be fewer caregivers, but also this is a characteristic of our society. There is less tolerance to the limitation of personal development, understood as a self-affirmation, so that there is a crisis of empathy and solidarity that eventually will affect the number of caregivers that are able, are ready to dedicate such a huge part of their lives to the care of dementia, people with dementia. So, as you can see, dementia diagnosis is one of the main reasons for institutionalized elderly people. But also, psychiatric problems, neuropsychiatric and behavioral problems are one of the main causes for demented people to be institutionalized. So, the consequence is that nursing homes have quite a high rate of psychiatric problems, as people with dementia have this high rate of mental illness and behavioral disorders, and also because it's likely that this rate is going to increase because of a funnel effect, because people that have this kind of psychiatric and behavioral problems, also their caregivers have more burden, so eventually they will make this number of people in residential homes with behavioral problems to increase. This was one of the consequences of this meeting of IPA, the International Psychiatric Association in Montreal, in 2009, and also some of the papers that were developed because of this meeting. You can see this high number of people with problems, in psychiatric problems in nursing homes, dementia, depression, behavioral disorders. Also, of course, there is a high number of prescriptions of psychoactive drugs in nursing homes, just because of this high rate of people with psychiatric problems. And mainly, as you can see here, these drugs are neuroleptics, antidepressants, and also benzodiazepines, that I think are the drugs that are causing more concern in these moments. The point in many of these studies is that there is no significant difference between the frequency of neuroleptics treatment given to apathetic and depressed patients and that given to aggressive patients. So it seems that this finding suggests that neuropsychiatric symptoms in demented patients are not being treated in syndrome-specific fashion, but in a way that is in a pattern that is more dependent on the culture of the institution. So, and also, we have to take into consideration that many times residential care facilities are not ready to face the challenge of mental illness because of a stigma of residential care, but also the lack of training of staff in these facilities, and the lack of formal psychiatric care or psychological care, but also because the absence of interdisciplinary work, because at the end, these facilities have been conceived as social centers, not health centers. So many times there is a low ratio of personnel, and these centers are many times understaffed. So it's not a surprise that in these centers there is such a high rate of use of this kind of drugs. So this high proportion of inadequate prescription in nursing homes includes psychotropic drugs in general, but particularly antipsychotics and low-antic benzodiazepines. Also, as we are going to see, this inadequate prescription is detrimental to patients. And also, as I pointed out before, the culture of the institution and the administrative needs influence the prescription rate. Well, this is a meta-analysis just to point out overall, the rate of inadequate prescription of any kind of drugs is quite high. You can see here Europe, 45% in residential care, USA, 30%, and other countries such as Australia, New Zealand, 35%. But also, not just the issue is with any kind of drugs, but also particularly with psychotropic drugs. You can see here some of the figures, and the point is that antipsychotic drugs are not particularly, in the 90s, we were thinking that new drugs, atypical antipsychotics, were more beneficial for patients because they have a lower rate of extrapyramidal effects, motor effects, and sedation. But along the years, with the use of these drugs, we have discovered that although they are better in these terms compared to conventional antipsychotics, the point is that they have still quite a number of problems. For example, we have here a comparison between antipsychotics, atypicals, and conventionals. And as you can see in the upper line, that conventionals are more harmful, but there is still a growing number of people with severe problems leading them to more death with the use of atypicals. Another point is that the patients who have been recently started on antipsychotics seem to be particularly at risk, especially in the first 30 days. So this is a critical period for the use of these drugs. Well, this is another study. This was made in Spain, and we can see here the number of falls with the use of antipsychotic drugs, particularly benzodiazepines and neuroleptics are the more harmful in this respect. And also, this is also a tendency for a high use of drugs. In this meta-analysis in Western European nursing homes, the antipsychotic use in nursing homes range from 12% to 59%, and antidepressant use from 19% to 68%. So this is another important point. With the same kind of facility, we have a very different rate of prescription. So it emphasized this point that the culture of the institution is affecting much more the use of drugs than the needs of the symptomatology of the patients. Well, this is a nice study. It's about the survival of patients when they are withdrawn from antipsychotics. And it shows that antipsychotics can be withdrawn effectively without and start of new symptomatology. So, and this study, is a comparison made in Canada about how similar institutions have quite different use of drugs depending on the culture of the institution. Now, this is a very important slide. It's about which favors overprescription. As you can see, most of the points are more related with the characteristic of the institution. A deficit in teamwork and communication, unresolved hierarchy tensions, staff shortage and high workload, punitive attitude toward errors. So, personal strain to keep things. Organization in large, big, huge units. Lack of alternatives. For instance, non-pharmacological approach. Also the kind of property, the habit of overprescription. The prescription by a doctor not belonging to the team, because in many facilities, at least in Spain, the doctor who is prescribing is in a health center and is not incorporated into the team that is working at the residential home. So also lack of training in the management of behavioral and psychological symptoms of dementia, no involvement of the leaders of organization, absence of an internal pharmacy service. This is a very important issue because intervention studies are considering that the presence of this service is always associated with a better use of drugs. No communication to families. So also it's important when you have to communicate to the family that you are going to use this drug, always there is a lower rate of use. And also the absence of person-centered approaches in the institution. So, the antipsychotic medication is a measure of quality. So that's why many efforts have been dedicated how to improve the prescription in institutions. So, and there are quite a different approaches. We have also, for instance, we have here, for instance, the example of the United States. The United States have been able to reduce the prescription rates with overall policy on the use of antipsychotics in nursing homes. And you can see here, this nice slowing down of a prescription rate. But this kind of policy, of regulatory policy, has also some problems. The same authors in the States have pointed out some challenges of this kind of policy, of regulatory policy. The one is sustainability, and also the difference between centers, and also the displacement to other substances, meaning that they are controlling very well antipsychotics, but we know that other substances, such as benzodiazepine and other sedatives, can be used instead of antipsychotics. And there are quite a few studies on different kinds of interventions. This is one study coming from the UK. I'm just going to mention a very, very nice, very interesting thing. You can see here two lines. One is the line on top, the line of control centers, and below the rate of the centers that were having the intervention, a training of the whole team. As you can see here, that at the beginning, both types of centers are going down quite nicely. The point is that having any kind of intervention, just if you know that you are going to be controlled, reduce the number of the use of drugs. But then, you can see how both lines separates. So the thing is not just to try, that is very nice, to try to control the use, to improve the use, but the point is sustainability, how to continue, because everything is going to improve things at the beginning, but the problem is how you continue with an adequate prescription. So as I mentioned, there are quite a few. The point is what to do. And there are now several meta-analyses on that. This is a meta-analysis on any kind of how to reduce inappropriate use of drugs, any kind of drugs, and intervention using educational outreach, on-site education, and pharmacist medication review. That's the point I mentioned, the presence of the existence of service of pharmacy. But also, when you look at, this is another meta-analysis, so is how to reduce inappropriate prescribing of antipsychotic drugs. And as you can see, a reduction of 12–20% can be obtained in the short term without just to measuring, but sustainability requires an institutional change, adaptation to the resource and availability of non-pharmacological alternatives. So just going to finish my presentation. These are some efforts here in Spain in this line. This is a document of the Spanish Society of Psychogeriatrics. And these are the CROM criteria, chemical restraints avoidance methodology. This is a project by the Maria Wolf Foundation in collaboration with the AFA, the Spanish Confederation of Associations of Caregivers. And the point is not just to reduce the number of prescriptions, but also to adopt this kind of culture principles that promotes and support the mental health of residents. This is basically the methodology: raise awareness about the problem and involve all parties concerned, leadership, specificity, so criteria has to be adapted to the specific characteristic of institution, provide rigorous information, disclosure and criteria and methods of application, and also interdisciplinary work in situ with the development of unprotocolized alternatives. This is the path of CROM criteria. We are now, and the last is just the validation after a cultural adapted definition of chemical restraint, the definition of neuropsychiatric syndromes adapted to the Spanish culture, and also operativization and accreditation. These are the syndromes we are working with. And finally, we've been able to have a pilot study on this center in the Canary Islands, in Las Palmas. So we are going to work on the results. This accreditation was made last year, and now we are working on the results. So my conclusions: there is still a growing, despite of many efforts, there is a growing effort. There is a growing trend towards institutionalization. There is a high and inadequate prescription rates. Improving prescription is feasible, and sustainability equals training and cultural change. Thank you very much.